imagine a health issue that silently weakens your bones, making them fragile and more likely to break from everyday activities. This condition affects millions of people from around the world, especially as they age, and often it goes unnoticed until a fracture occurs. In this video, we'll explore the risk factors, signs and symptoms of this hidden threat to bone health, as well as effective ways to manage and prevent it through targeted physical therapy. Join me as we uncover how you can protect your bones and maintain an active lifestyle. Let us learn osteoporosis. So, what is osteoporosis? It is a chronic condition characterized by weakened bones that become fragile and more susceptible to fractures. Often, it develops without noticeable symptoms, meaning many individuals may not realize they have it until they suffer a fracture from a minor fall or even with everyday activities. Now, osteoporosis is very much common among elderly individuals. As a matter of fact, osteoporosis is common to people aging over 50 years, with a worldwide prevalence of over 200 million people affected by such condition. In the United States, over 50 million people live with osteoporosis. And in the Philippines, adult Filipinos aging from 60 to 69 years are about 0.8% at risk of having such condition, while those beyond 70 years old are at 2.5% at risk. Osteoporosis does not happen suddenly, but it can be brought about by so many different factors. However, the primary reason as to why osteoporosis occurs lies on the fact that there is a presence of bone density loss, where the body loses too much bone or fails to produce enough new bone, leading to a weakened bone causing osteoporosis. Now, it is essential to determine the primary reasons as to why bone density loss could occur in the first place, and these are the primary reasons or risk factors that could lead to osteoporosis. First would be the age. Age is another significant factor, especially for those people who are of old age, because the risk increases dramatically in individuals over 50 years. This could be due to the fact that there are also degenerative changes that are happening inside a person's body whenever they age, and that could affect a person's bone strength, leading to your osteoporosis. Next would be your hormonal changes, which play a crucial role especially in women after menopause due to decreased estrogen levels. Now, the reason for this is that estrogen is actually a key part of metabolism. It promotes the activity of osteoblasts, which are the cells that make bone. When a person has low levels of estrogen, they have an increased risk of osteoporosis and even fractures. Next would be genetic factors. If osteoporosis runs in your family, then you're at risk or maybe at higher risk of having osteoporosis. And finally, the lifestyle factors such as low intake of calcium and vitamin D, a sedentary lifestyle, smoking, and excessive alcohol consumption can further increase your risk of having osteoporosis. Now, the reason for that is because vitamin D is responsible for facilitating calcium absorption for our bones. So if you have enough calcium intake but an insufficient vitamin D intake, there's still a lack of calcium absorption. Also, in terms of smoking and alcohol drinking, it both affects the body's ability to absorb calcium, leading to a lower bone density and weaker bones causing your osteoporosis. Even though symptoms of osteoporosis are often not noticeable until a fracture occurs, some common signs could still be observed. First would be the severe back pain from collapsed vertebrae. Next is the loss of height over time. And lastly is a stooped posture, sometimes referred to as kyphosis or hyperkyphosis. In terms of back pain, a person might actually feel severe pain in his or her back if one of the vertebrae, which are the small bones in your spine, collapses due to weak bones. In terms of loss of height, over time, a person might actually notice that he or she is losing height because of the compression fractures in the spine. And also, the stoop posture, which is a noticeable curve in your spine, can develop, leading to a hunched appearance. And generally, people might actually feel a general discomfort or tenderness in their bones before any fractures can happen. So understanding these causes and symptoms is very important because it helps you recognize if you might be at risk for osteoporosis. And so early detection and lifestyle changes can make a big difference in maintaining strong bones. Now, since that we're talking about the detection of your osteoporosis, here are the ways as to how a person can actually detect or do an early detection of osteoporosis. To detect osteoporosis, healthcare professionals primarily use bone density testing, which measures the amount of minerals, particularly calcium, in your bones. And the most common and reliable test for diagnosing osteoporosis is a dual energy X-ray absorptiometry, or the DXA scan or DEXA scan. This test is quick, painless, and non-invasive. The results provide a T-score that compares your bone density to that of a healthy young adult. A T-score of -2.5 or lower indicates osteoporosis. Now, people might actually think that X-ray could potentially be one of the imaging tests that could be done to a patient with osteoporosis. Well, that could be true. However, osteoporosis is being diagnosed by determining a person's bone mineral density, wherein the X-ray cannot really do such thing. However, X-ray could be beneficial if there's already a suspected fracture in order to locate which part of the spine or which part of person's bones is actually being affected by osteoporosis. And lastly, a healthcare provider may also conduct risk assessments by evaluating personal and family medical history to identify potential risk factors. Now, here's where the importance of physical therapy comes in. Physical therapy is essential for managing osteoporosis effectively, and here's why. 1. Physical therapists create personalized exercise programs that can focus on strengthening muscles and improving balance, which can significantly reduce the risk of falls and fractures. 2. Regular exercise helps maintain or improve bone density and overall mobility. Activities like weight-bearing exercises strengthen bones while improving posture and coordination. 3. Therapists also educate patients on safe movement techniques, helping them perform daily activities without putting unnecessary stress on their bones. And lastly, for those who have already experienced fractures, physical therapy aids in rehabilitation by restoring strength and function. If diagnosed early, osteoporosis can be effectively managed through various strategies. First, lifestyle changes are crucial, and so engaging in weight-bearing exercises like walking or jogging can help strengthen bones. Second, maintaining a balanced diet rich in calcium and vitamin D is essential for bone health. Third, avoiding smoking and limiting alcohol intake can also make a significant difference. And lastly, in some cases, medications may be prescribed to help strengthen bones and reduce the risk of fracture. So how do we prevent osteoporosis? Preventing osteoporosis involves proactive measures. It all starts from your own decisions. 1. You could ensure you get enough nutrition with adequate calcium and vitamin D. Second, you could stay physically active with regular exercises that promote bone strength. And lastly, you could make healthy lifestyle choices that support your overall bone health. In conclusion, understanding osteoporosis is vital for prevention and management. By recognizing the risk factors and symptoms, you can take proactive steps to maintain your bone health and reduce the risk of fractures throughout your life. Remember, physical therapy plays a key role in this journey by enhancing strength, balance, and overall quality of life. #BreakFree from osteoporosis. Thank you for listening and have a great day.